Summit School District scholars, staff, and families. My name is Mickey Grevitz. I'm the Communications Director for the district. And as we have seen an increase in cases from the winter holidays, we want to remind families about the health and safety protocols and quarantine guidance. The district is committed to continuing in-person learning as long as it is safe to do so, and following these health and safety measures gives us the greatest opportunity to continue to provide a consistent and safe learning environment for all Summit scholars. A couple of quick reminders. If you are sick, please stay home. Please notify your school of symptoms and immediately get a test at one of our free community testing locations. If you lose your sense of taste or smell, please stay home. Call your school and get tested immediately. Maintain your 6 feet of physical distancing, wear your face covering in public, wash your hands frequently, and complete your symptom tracker even if you're quarantined. If you are asymptomatic and have been in close contact with someone who has tested positive, you should quarantine immediately and then get a COVID test on day 5 from the last day of contact. If you test too soon, your test result could have a false negative result. Curative swab testing, which was provided by CDPHE, is phasing out due to the significant number of false negatives per a press release last week. For quarantining guidance, CDC indicates that quarantine durations may be reduced to 7 or 10 days for individuals exposed to COVID-19. Although the 14-day quarantine is still the gold standard for quarantine durations. Reduced quarantines may support schools to better manage COVID-related staffing shortages and greater continuity of learning. Each quarantine is a unique situation and assessed by a health professional, and the district will work to shorten quarantine durations if possible. Yet, there are limitations which may prevent shorter quarantines, including the logistical challenge of verifying negative tests across multiple testing sites and agencies, and staff's lack of access to results. The instructional challenge of providing in-person learning for some scholars while simultaneously supporting some scholars virtually who are awaiting tests and/or results. And the inequities and barriers to testing that contribute to delays in obtaining testing and/or results. The district may provide a 10-day quarantine option depending on each unique situation, in which staff must also meet the 10-day quarantine requirements for a cohort to return. Staff and scholars must not have experienced any symptoms during the quarantine, and a 10-day quarantine won't be able to be determined until after the quarantine has started. Please refer to this calendar graphic for an example of a 10-day quarantine. This calendar shows that your last day of contact with a positive person is considered day 0. The next day is considered day 1 of your quarantine. The last day of your quarantine is day 10, and on day 11 you may resume normal activities, but be sure to monitor your symptoms. The district may use a 7-day quarantine in the event that the quarantine involves a unique one-on-one interaction, a quarantine that was initiated outside of school and not involving the remainder of the cohort, and a 7-day quarantine would involve having no symptoms and a negative COVID test on day 5 or later. Thank you all for your continuing support and partnership in keeping our schools, scholars, and staff safe and learning in person. Thank you.